Before the break, we read an email from Pam who suffers from a leaky bladder and claims she doesn't feel as tight down there since having her children. Pam's not alone. 14 million women have the same problem. It's called urinary incontinence. And what happens with urinary incontinence is the blood is filtered through the kidneys, creating urine. It goes into the bladder. And usually when the bladder fills with urine, these pelvic floor muscles will keep it in your bladder. But unfortunately for some women, particularly after childbirth, it leaks through, causing the incontinence. Well, there's a new procedure called gen2, and Dr. Julie Ryle is from the Advanced Laser Center in Billings, Montana, here to discuss it. Take it away. Welcome to the show.
Thank you, guys. Welcome.
Thanks.
Julie.
So happy to be here.
Thanks for coming.
Great to have you.
So tell us about this great new procedure you have called gen2.
All right, gen2 is a procedure for women specifically to treat and help them with stress urinary incontinence. And that's a condition, surprisingly, that affects women of all ages, particularly after you've had your first baby.
It's an embarrassing problem because women will leak urine at really inopportune times, and it can be really distressing for women.
And in the past, it's usually been a surgical treatment.
Right, with slings and things like that. Now there's new options for women, which is really great, the new technologies that are coming out.
Exactly. This is an existing technology that has simply been applied to a new area of the body.
I want to know how it works.
Okay, let's imagine after having a baby that very much like the skin on our face, the skin down below in the external genitalia becomes saggy and loose. And after the deep dermal heating is applied...
So this is what you're doing with your handpiece. It's deep dermal heating.
Deep dermal heating, exactly.
And this is going to be on the bladder tissue or underneath.
It's specifically the external genitalia, so it's performed by a gynecologist. This is the application of the light device, simply applied to the skin.
And a bipolar device that's transmitting heat into the deeper dermal tissues, right?
Yes, that's the second
similar
layer
to what I do with radio frequency heat on the face and on the body. Yeah. So you are actually getting cosmetic improvement too, aren't you?
There's a remarkable cosmetic improvement and other improvements including sensation. And returned enhancement of that.
But we have to caution, as a gynecologist, this is a new procedure, so be careful. It's a new technique. I think we need to watch it a little bit.
And Dr. Ryle, you actually have one of your patients that you've treated with this therapy, the gen2. Lisa's in the audience today, correct? Hi there, Lisa. So Lisa, are you glad you did it?
I'm really glad that I went through the process.
I mean, were your symptoms that severe before you did it, or?
Well, I'm a hairstylist and a fitness instructor, and sometimes I'd have to leave my class, you know, in the middle of the class to go to the bathroom or leave a client. Now I can make it through a whole, you know, client or class, so yeah. Also, it's great because it also changes, you know, physically. I look 21 again. I have had 3 kids. I look 21 down there.
That's great. It worked out for her.
Well, I want to thank Dr. Julie Ryle and Lisa for coming here today. And back to you, Travis.